So I'm Elena. I'm a nutrition major, and I'm at the Biddeford UNE campus. I'm a sophomore right now.
Oh,
so.
okay. Welcome. Elena?
Thanks. Yes.
Okay.
My name is Whitney. I'm actually in the online master's applied nutrition program here at UNE. So,
Have I had you yet?
no, not yet.
No. Okay.
The next class.
Summer? Oh, good. Okay. Oh, now I have a face.
And I'm Courtney, and I had you last semester
Oh.
for this class, Courtney Mejia.
Yes. Okay. Oh, nice to see you. Welcome.
And you know me already, I'm on 2.
Okay. Awesome. All right. So thank you for doing that. So what we did in the first session is I've got some slides, but we really just kind of had a conversation about MI and the different skill sets that go with it. So just kind of building a little bit on what we did earlier. Does that sound like an okay thing? Okay. So I'll just give a little bit more of a background. So I want you to know that it takes time. It definitely takes practice. And so I didn't have it together enough to put a Portland map up, so you've got Rochester. But so there's really 8 stages in learning MI. And so, like I talked about the spirit, so that's one of the first things. I just don't want to have my back to you. You know, really bringing in the spirit of MI to your sessions is one of the first things that you would be able to do. And I remember you had a pretty good grasp on it when we were doing it. So the next piece are the skills. And I didn't go into those in the first part because that's what a full training should really be. So they're acronyms, so this is the other acronym for the skills. So we can talk a little bit about those. The change talk, again, is just really important, recognizing it and then figuring out how to strengthen it and how to kind of evoke that and draw it out. Rolling with resistance, again, we're kind of moving away from that term, but it's dancing with discord. So, you know, if you're starting to feel that strain in your session, self-reflect and look at you and kind of see how you're going to tweak that. Getting towards the plan, getting commitment, and then MI can kind of fit in with some different theories that you are working with, different counseling styles, so it really can fit across the board. Or you can just use straight MI. What we were starting to talk about in the other section is, have any of you heard about self-determination theory? Have you heard of that? Self-determination theory? No? So they're looking at self-determination theory as a way to explain how and why motivational interviewing works. Because the components of self-determination theory are very similar to MI. And it's relatedness, competence, and autonomy. And so they're looking that it's actually a way to explain MI, because MI is not based in theory, it's based in experiential experience. I guess I'll just leave it at that. So we actually have just connected, so in Rochester, all the members of the Motivational Interviewing Network of Trainers, the Mint people, we've kind of created our own little group in upstate New York. So we meet once a week. The people that created and developed self-determination theory are at the University of Rochester. And so we've had a few meetings over the past couple of months trying to figure out how we might be able to collaborate, look at research, because this is a pretty hot topic. So if you went to PubMed and looked up self-determination theory and MI, you'll get some really good articles. I think it was in 2012, there was a big, almost like a supplemental addition to a journal that has got a whole bunch of articles on that. So if you're interested, you can kind of look at that. So we don't have to go over this again, but I just wanted to just take a second to just kind of rehash it. So, you know, if you can bring that spirit in, it's going to be helpful. We talked about a couple of the principles to be able to, you know, have them be on your radar. So the skills here, that's, again, like I said, if you do a training, this is where you're really going to practice it. But what I've got here in the slides are just some examples, and we can kind of talk through it if you'd like. And then, again, just working through towards behavior change. Okay. I like this slide because this is weird. It's a way of kind of separating it out and looking at the foundation of MI and how you're going to draw from it. So the spirit is the foundation. The principles and the spirit together are just a way of being with your client. So that's a way of just kind of bringing it all in and having that atmosphere in your session. Behaviors are where you're going to start using the skills and bringing the skills in. But if you can bring this into your session, it should have some positive impact to be able to help it, build, flourish and really be able to get that going. Any questions about that? Oh, okay. So within motivational interviewing, so within a session, you're going to have these 4 processes going on. I've got it this is kind of how ideally it would go, but in reality, you're probably going to be bouncing back and forth between a couple of them. So again, kind of tying in what we talked about this morning, first thing you're going to do is want to engage your patient, right? You're going to engage your client, bringing empathy in, bringing the spirit in, avoiding the writing reflex, focusing. So if you're interested in motivational interviewing, the best way to get feedback and see how you're doing is to actually have a session recorded, sent out, and coded. And so we're trained to listen and to be able to identify what skill sets you're bringing in, what your globally, if you're bringing in the empathy and the compassion. So if you decide to do that, you actually have to highlight behavior change. So you actually have to let the coder know what you're zeroing in on, because we have to be able to listen to that and see if indeed you're helping them get to that point. Does that make sense? Okay. And then evoking, so getting into that intrinsic motivation, right? What are the reasons for change? Why do they want to do that? Evoking is really what makes MI. Okay, you don't really need planning, but it's a nice end game. But it's that evoking piece that really helps to make MI. But like I said, if for some reason, you're up here, you're kind of focusing, you're talking, and maybe accidentally you bring in your writing reflex, right? Well, but if you did that, this might happen. Intentions are good, and that's what I hope people got is your intentions are completely good, but you might want to check it, and you'll need to re-engage at that point if you kind of sense that there's some sort of discord going on. Do you see how that can kind of flow? So these are the skills. And again, these take practice. Give yourself time and don't beat yourself up if you don't get it all at once. But open-ended questions. So do you know what open-ended questions are compared to closed?
A closed question is like, there's like yes or no, like a closed question. So then they stop and they don't keep talking.
Yes.
An open-ended question allows them to keep answering the question.
Yep, so thank you. So exactly, so yes or no. So the open-ended question just allows for a deeper dialogue. And it really helps to build empathy. So going back, number one predictor of treatment adherence is a patient feeling that you're empathetic with them. Affirmations, so we'll talk a little bit about them if we get far enough along. But researchers have found that affirmations are the one skill that is correlated with decreasing sustained talk and increasing change talk. So initially, a lot of the focus has been on reflections, right? Because they really go a little bit deeper, they dig a little bit more. But the affirmations, they actually have found it helps to get that change talk going, which is ultimately what we want. It helps to build confidence too. So we can talk a little bit about that. The reflections, I think this is the hardest skill to get. It takes a lot of practice. It's basically making a guess as to what your patient feels. It's okay if you're wrong, but you're exhausted, you're frustrated, you don't want to do it anymore. You really don't like these nutrition sessions. So it's a reflection. And they'll correct you if you're wrong. But this really helps you get to a deeper relationship and building that empathy and just starting that positive cycle. And then the last one are summaries. And basically what you're doing is you're listening, and you're kind of tying it all up and giving them a little summary bouquet back. So you're making sure that you heard them correctly. You're giving them an opportunity to say, yes, you're absolutely right, or, you left this part out. Again, it's building that relationship. But they feel heard, they feel listened to, and it's really nice when you're sitting with somebody and they are able to put it back to you, and you're saying, yeah, you're right, that is exactly how it is. So any questions about those? No? Okay. So just to kind of give you, again, some takeaways, that's what I'm kind of hoping for out of this, is just kind of build a little bit on what we did this morning. So open-ended questions. So how do you start them? Then another thing you want to be careful of is you might start out with an open-ended question and then jumping the gun and actually turning it into a closed. So I got dinged on this for my dissertation. I had my sessions coded, listened to, and I got feedback. So tell me about your beverage intake. Do you drink juice? Instead of like letting it sit, right? You just are jumping the gun. You're wanting to get into it and listen to it. So one of the things with MI is you have to be comfortable sitting with silence. If you are talking more than your patient, chances are you're not doing MI. So a really good gauge is if your patient is talking more than you are, you're doing something right and getting that conversation going. So, you know, these last two are one of my two favorite ways to work in open-ended questions, right? So tell me more about, okay, rather than can you, did you, tell me more about that, or help me to understand, you know, where you're coming from. You can always say why, that's always a good one too, but I find the tell me more about is just a softer way to do it. And it opens it up for a safe space for them to be able to talk with you a little bit. Questions on that? Thoughts on that? Would you like to practice? This is what we did last time. So would that be all right? Yeah? Okay. So do you have any concerns about your current level of activity? How could you flip that around and make it be an open-ended question? Yeah? Or yeah, just tell me about your current level of activity. Perfect. Yeah? So just kind of shortening it up and, oh, the mic. Oh, that's okay. Yeah. So I can rehash it for you if you want. Okay, perfect. Ooh, you each have a mic, and you get a mic, and you get a mic. It's like Oprah. Okay, so any other ideas or thoughts on how you might turn that around? Oh. Did it go?
I can text it and see if it's used a different one. It's off. Okay. Now I have to remember what I was going to say.
Oh.
Does your current level of activity make you feel good?
Okay,
Something
so
like
you spun it around, but how could they answer that question? What would the answer be more like?
Oh, that's true. It would
right?
be like a yes
So
or no.
yeah,
So like, how does your current activity make you feel?
exactly.
Better?
So do you see how that shifted right around?
Yeah.
And it opens it up for you to be able to really have that conversation. Yeah, good job. Thank you for doing it. I know it's a little embarrassing.
Yeah.
It is. And if at any point you feel uncomfortable and don't want to, feel free to pass. You can always pass. So it was Whitney, right? Is that right? Okay. Do you want to go to the next one? Would you be okay with that? Okay. So do you want to go to our diabetes class?
I'd probably ask, how do you feel about attending the diabetes class?
Right? Perfect, right? How do you feel about that? Yeah. Anju, are you game for doing the next one? So how many days a week do you currently go to the gym? Oh, sorry.
Like, can you say something like, are you able to tell me how many days a week do you currently go to the gym?
Yes. So,
Um,
if you dropped able to, right? Because if you say, are you able to,
yes
they could
or
say
no.
yes or no,
Okay.
right? So, but, do you want to try it again?
Can you tell me how many class a day, how many days a week do you currently go to the gym?
Yeah. So, or even tell me about your current gym habits, if at all. Right? So you could always add in that if at all piece to take it away from that, because maybe they're not going. Right? So you don't
See,
want
yeah,
to, right?
true,
You don't
yeah.
want to make an assumption. So, tell me about your current level of activity, if there's any at all. So you soften it, you give them room to be able to say, oh, well, I'm not really doing anything, without feeling judged. That you're not, you're not catching them off guard. Does that make sense? Okay. We can open up this last one. Like, what is your weight? How could you maybe rephrase that?
Maybe like, how do you feel about your body?
Yeah, yeah. Or even, how do you feel about your current weight? Yeah, perfect. So I'm going to take this opportunity to also plug Health at Every Size. Are you familiar with Health at Every Size? No? You'll be familiar with it in about a month. So Health at Every Size it's a non-diet approach to counseling. So rather than focusing on weight, you're really focusing on healthful lifestyle choices, eating foods you enjoy, finding activity that feels nice, rather than you need to drop 20 pounds, get your BMI to 24, and all will be right with the world. So it's a shift. So it's, again, trying to figure out, like, I really wouldn't talk about weight in my sessions at all. I just wouldn't do it because they're already getting blasted. And we can cover things in a different way to help kind of get them, because I guarantee you, they're probably going to want to lose some weight. Well, but a meal plan isn't necessarily the best option. So how can we kind of work through that? Does that make sense a little bit? Okay. So affirmations. This, like I said, a study done in 2016, so quite recently. The affirmations are this only skill right now that we've got evidence for that decreases sustained talk, which is what? What's the sustained talk? Do you remember from the morning?
Sustained talk when they want to stay where they are,
Right.
and they're resistant to.
Exactly. The status quo, right? So sustained talk is not for change. It's just staying at the status quo. And so if you're utilizing these right, they're going to decrease sustained talk and increase change talk, which is exactly what we want. And the rationale is that it's going to build confidence, it's going to build self-efficacy, and it's really going to help them feel that change is possible. So the thing with affirmations is that you want to make sure that they're specific, that they're genuine, and that they're unique. Saying, an affirmation wouldn't quite be, you've done an awesome job. You're offering praise, but what does that mean, right? So you want to pick something specific. So you've done a great job keeping a food journal. You've worked really hard. So if a patient comes in and they've kept a food journal and they've kept a symptom journal and they're coming back, they've been focused, they've been determined, they've been dedicated. So do you see you're zeroing in on a specific strength? And that is what you want to do with an affirmation, is identify what is it that they're doing. You also want to be very careful of saying, I'm proud of you, because you're turning it around and making it about you, right? You're proud of them. But what did they do to help to identify they should be proud of themselves? And so that's finding those specific traits and those qualities that they brought in. Does that make sense? So we can do, let's see, how are we on time? Do anybody have a watch? I don't know. 2:35. 2:35, okay. So this, I can email this to you if you're interested. This was created by Steve Miller and Bill Miller and Steve Rolnick. I'm mushy today, I'm getting tired. And some characteristics of successful changers. And so what this list does is it gives you some qualities that might give you some ideas to apply to your session. So affectionate, right? So we might be totally off of a nutrition piece and somebody's talking about how they tried to help find a lost dog or they tried to save a dog that was in the road. If they're telling you this story, affirm that. You're a really kind-hearted person. You've got a big heart. So again, finding that particular piece that's going to build them up. So understanding brave. I use brave a lot with my patients because they are. You're talking about changing your life, and they're brave to do that. Skillful. I like, what's another one? Effective is a good one. I use exhausted a lot because my patients tend to get very exhausted. Persistent, I use that a lot. I use perseverant a lot. But again, when you're sitting with your patients, you're going to be able to hear and identify what sounds good.
Just let's go back to that one. Do you know why stubborn is on?
Well, okay. So this came up in my class. So the question was for people, no, it's okay. I'll repeat it. Is how is stubborn a positive trait? Do you guys have any thoughts on that?
Well, it could be that they just stuck with it no matter what was happening.
Yeah. Yeah. And so that's our thought. So this was a whole conversation in my counseling class. I also take it to be determined, right? It's a different way of saying determined, but you could say if you've got an elderly patient who is in the hospital and they just had a hip replacement and they've been getting out there, and he wants to get home, an older man might really respond to, you're a stubborn old goat, nothing's going to stop you, right? So it's a way to, somebody might very well relate to that word, and you can turn it into a positive. Does that help a little bit? Yeah, it was probably a good 15-minute conversation in class. Yeah. Did you have thoughts, Courtney?
Oh, I was just thinking maybe if someone is going against the status quo in a positive way,
Yeah.
it could be like,
that they
being stubborn.
haven't slid back at all, right? So so those are, it's a really good question, and I get it quite a bit. But it's how do you turn that into a positive? And there probably are going to be populations that would respond to that word. You are stubborn, and nothing's going to get in your way. You're going to achieve it, right? Does that cover it? Okay. Any other questions about any of those that you see? Okay. So what I did was I just kind of created a little activity if you want to practice. So would that be good? We can kind of read the narrative and come up with some thoughts? Okay. Thoughts on an affirmation that you could offer Tyler, the 55-year-old electrician?
He has persevered to keep avoiding the gluten.
Yeah, he's perseverant. Yeah, that was one I had found too, yeah. Anything else you see in there?
I think the other thing is you can probably acknowledge that, like it was like the last sentence, like it wasn't easy, but he feels successful. So, kind of showing that support that it is not going to be an easy course, especially if you learn growing up eating normal food, and now you have to learn to read the label. You have to watch what you eat and things like that to prevent yourself from being sick. It's a lot of work and commitment, because if you don't commit to it, you are the only one who will suffer, and you will know the consequences of it. So somewhere like that, feel his like empathy part type, like that it will not be easy, but he's showing some success, so keep encouraging that going forward.
Exactly.
Yeah.
Yep. So he's perseverant, and he put that hard work in, and he reaped the benefits of his hard work. Right? So persistent, focused, might have been a little frustrated, but he did it. And it was because of his hard work and determination to feel better. Right? So good job. Yeah. Anybody else see anything in there that jumps out at you? I think you did a good job. No, I think you did a good job. He's perseverant. He worked hard. He's determined. He might have been frustrated, but he kept on keeping on. Whoever said that, I don't know, was it Bob Marley or something? Keep on keeping on, right? So good job with that. So thank you. You want to do one more, or do you want to move on to reflections? Want to do one more? Because remember, these have been found to be beneficial. So I think it's good practice. Anything jump out at you?
I feel like I was thinking brave with this one. She's been through a lot, and to continue to make changes in her life. To
Yeah.
take,
Bravery.
brave, contagious.
Yes. Yep. And that was, my students picked up on that too, is the bravery, right? So end-stage renal failure, and now her only good kidney is left. And she's not given up. So she's very brave to keep kind of persisting through. Anything else jumped out at you? What about determined? Could you see determined in that? So not only that, but she's going to have to start dialysis and make those changes, but she's in there. She's in it to win it. So she's determined to make sure she gets through okay. Any other thoughts? Good job. Yeah, I think, bravery is good. And do you see how a right affirmation could build her up if she's feeling discouraged, right? It really is going to help build their confidence and their self-worth and their self-efficacy to be able to handle what they need to do, right? Okay. So reflections. This is basically a hypothesis test. That's ultimately what a reflection is. I would say that this is probably the more challenging skill to get because there's a couple of different types of reflections. One is just very superficial, and you're just kind of repeating back what someone has said. And then there's complex reflections, which you just dig a little bit deeper, and you're guessing at a feeling, a meaning behind where they're at. This could easily be turned into a question. So a reflection, you could kind of start it like, it sounds like. So remember, you always hear those back in the, in the old kind of counseling books. It sounds like you're feeling very tired. But what you can do is that can be kind of a diving board, like a springboard to kind of get you to that point, to get you in the habit of saying reflections. It sounds like you're frustrated. It sounds like you're tired. It sounds like you're really happy with what you've achieved. And then eventually you can work and just drop the it sounds like, and just you're very tired. You're very happy with what you've accomplished. But getting the habit of saying it sounds like just will help you practice the reflections. You can do these at home with your spouse, with your friends, and watch how your relationships shift. Because it is just a softer way, and people are going to feel heard. So it's just one of those things. You can. One of the things we tell you is to, if you want to practice this, listen to talk radio or watch a TV show, and just kind of practice reflections back to yourself, as you're watching. But if you want to kind of get in the habit so that it becomes part of your everyday life, is an option to do. So just making sure that you don't kind of flip your voice up at the end, right? So, you're feeling really tired versus you're feeling really tired. So do you hear the difference? So if you get your sessions coded and they hear that intonation go up, it'll be coded as a question and not a reflection. So these are the things that you'll fine tune as you practice. So again, just to kind of talk about, so the simple reflection, so an iceberg, I like this visual. So simple reflection, you're just going to repeat or rephrase it. You're just going to kind of put it back. But the complex, you're going to be bringing something else into it. So, going back to the example this morning, like I don't want to stop drinking with my friends. If you went and said, you'd feel completely alone if you stopped drinking, you'd have nobody. So somebody could very well say, yeah, that's exactly how I feel. I want all of my friends drink. Versus, well, I've got a few friends that, aren't really into the party scene. And so they correct you. Okay, so, what would that look like for you? If you did decide not to drink, as you're trying that, what would that look like for you? And get them moving in that shift. So that's what the reflection is going to do, is kind of dig a little bit deeper on where you want to go with that. And again, if you do a training, this is what you'll practice doing. You'll do, we call it batting practice. Just kind of go and go and go. So just again, to kind of give an example. Okay, growing up, my mom always complained about her weight. She was always dieting and making us eat her diet food. Okay, so simple. Growing up, you had to eat your mom's diet food, right? Just putting it right back. Yeah, it was really annoying and it was gross food, and we had to watch everything we ate too. Complex, you're bringing something deeper. Your mom put everyone on her diet, making you feel deprived at times and wondering if your body wasn't okay either. So what you're doing is you're bringing out any sort of body image kind of concerns, right? Mom was complaining about her weight. Maybe that's something that's floating around. They didn't say that, but you're going to dig a little bit deeper and throw that out there and see if, that's how I feel, and it'll open up that further dialogue. Does that make sense? Yeah. So a double-sided, this is, I think, very helpful in developing discrepancy. So what you're doing is you're kind of pulling out both pieces of it. So you've got, on the one, you're going to identify the status quo talk that they're having, and you're going to end on the change talk. So so we can use this one here. So I know I need to switch to diet sodas, but I just can't stand the taste of fake sugar. Okay, so right, so there's two things there. I need to switch. So there's the change talk, right? So part of the darn, there's your change talk, okay? But they don't like the taste. There's the status quo. So on the one hand, you're not so sure about that taste of the artificial sweeteners, and on the other hand, you're concerned about how regular soda might be affecting your blood sugar, right? So, and I wonder what you're going to do with that. I'm wondering what you're thinking about doing with that. The key is to use the word and not but, okay? Because you're tying it together. If you say but, you're separating them out. So and is that key. If you say but, it's not a big problem. But, as you're honing it in, and, because it's both there. I wonder what you're going to do with that. I wonder what that's going to look like for you. Does that make sense? Yeah? So, a little practice. Are you up for practicing, or do you want to kind of keep going through? Would you like to do a practice? Okay, all right. Thank you. Okay, I'm so tired of this life. I've tried to lose weight so many times. This only works for a little while. And then I'm eating all the things I gave up again, and it's worse than before. I just don't know what to do. So what could be an example of a simple reflection back to that?
When you try to lose weight, you end up eating all the things you did and it was worse before?
Yeah. So you
No,
had
I
it
did
right.
and.
Did you see what you did? Did you see you flipped up at the end? So you're right, exactly. So it's so easy so it's just kind of practicing. So you were right on, you nailed it. And so it's kind of focusing and making sure that intonation kind of stays even. But yeah, you've tried to lose weight and then you end up eating more and it's a vicious cycle for you. Yeah, good job. Thank you for jumping in. Oh, and I always ask before I give feedback because sometimes I jump the gun because was that okay? Okay, all right. Any other simple reflections you see in there?
You've tried to lose weight and you end up not knowing what to do.
You lose weight and gain back and you just don't know where to go with that. Yeah, good.
Or I guess it could be just as simple as, so you've tried to lose weight in the past.
Yes, perfect. Summer, you're just putting it, good job, very good job. Do you have any symbols that you can think of? Okay. Okay, so what about a complex? So this is where you're kind of looking for a deeper feeling or meaning that the patient didn't necessarily say, but you're trying to identify.
You seem frustrated that you tried to lose weight in the past and keep eating the things that you gave up again, and it gets worse.
Good. So you brought in the frustrated piece, right? They didn't say that, but you can kind of take away from it that they're irritated and frustrated. Yep, so good job. Anybody else see a complex in there?
Could it be as simple as like, because I'm sensing beside the frustration, I'm sensing confusion. So
Yeah.
just not sure how to like tie it in, but I mean, it could be with so many different weight loss methods out there, promoting by different, let's just say celebrity for one example. Like I'm sensing some confusion or something that might help, with the weight, because it's always like you hear one day it's like do this, and then 3 weeks later someone else said do this, and then so if you try and then you don't get the success that you are, then you kind of are exhausted and frustrating with what you're
Yes.
doing. So I'm not sure how to like tie it in, but I'm sensing a confusion in there as well.
So you zeroed in on what you were pulling out of there. So you're going to throw that out there. So I think you're right. Confusion is probably right there. So anybody else have a thought on how to kind of use confusion with that? You're just confused and don't even know what to eat. Right? Because that's ultimately what it is. You just, right? It's, so that, do you see what you're doing? You're just kind of, you're bringing something there that isn't explicitly said, right? Yeah, you're confused and not sure why, you just can't seem to get into a routine or a rhythm to get to where you want to go, or you're tired of being in the cycle and breaking out, right? You're ready to be done. Anybody game for trying a double-sided? And finding the discrepancy in there? Sure, yeah. So the question was, can you just explain the double-sided? So what you're doing is you're identifying the discrepancy. You're looking for the sustained talk and you're looking for the change talk. So you want to be able to pull out the sustained talk and end with the change talk and tie it together with and. It's okay, if you want me to jump in, I can. I'd like to give you a chance if you wanted to.
I know, I was going to say, could it be something with like, you understand the importance of eating, the right food to help with weight loss. Now I'm going bad.
No.
But and then there's like the end is somehow trying to okay, you understand the importance of weight loss for fitness or for health well-being, and understand there's a correlation with food choices. So like somehow like yeah, tie it in like that like you end it on the positive side, that it's food related that can help you, you know, sustain a weight loss.
All right, so let me, so let me see if I can tie it in. So what you're trying to do is you're identifying kind of where they've been at, right? The status quo, but where they're wanting to go.
Yes.
Okay, so tell me what you think of this one. Okay, and so I'm going to try and tie that in. So you are just so frustrated, tired of it, and at the same time, you're back here and wanting to continue to persist. Right? So they're saying I'm giving up, but right, I'm tired, I've tried and tried, but yet they're still coming back. Right? So they're working towards it. Right? They're here, they're working towards it, they're recognizing, okay, you've tried to lose weight so many times, and yet you've managed to be successful before, right? Because they lost weight, might have gained it back, but they lost it. So zeroing in on, but you were successful before. Tell me what that looked like for you. Do you see how that kind of ties together? But again, this takes practice and skill, so don't feel, don't feel, like you're going to be able to kind of walk out of here. How are we on time?
We are 2:58.
So 15 minutes, right? I think. All right. So we're good. All right. So summarizing. So this is the S. So what you're doing is, it's going to demonstrate that you've been listening, and it's going to help your client feel heard. So you're just, lavender roses are my favorite, so that's why I picked this flower. So you're just going to kind of tie in all these beautiful things that he's offered you or she's offered you. Let me see if I've got this right. Okay? Let me see if I've understand what you've told me so far. So it's basically telling him, this is I've been listening. This is what I've heard, and putting it back. So you can then follow up. Okay, how did I do? Okay, is there anything that you'd like to add in or correct? Is there anything I missed? Okay, but if you get it right, and chances are you will. It's, you don't have to summarize every single thing, but tying it in. You've worked really hard. You've been successful in the past, and you're really ready to hit the road running and start it again. Just kind of tying that all up and helping them move forward with it. So a summary is really a nice way to kind of close things up and start moving forward. Okay, you're tying it and kind of ready to go back. Does that make sense? So we won't be able to practice this one because I actually had scripts, but I think it's just going to be too hard with the streaming. But that's really what the summaries are going to be. You're just going to listen real hard and kind of put back what you might have heard. So we can play around a little bit with change talk. I thought we could kind of play around. So okay. So, well, my doctor's been nagging me, and I'm beginning to think she's right. I've got to do something, or my liver just won't take it anymore. Besides, my blood pressure's just too high. So what do you see in there? So change talk, do you remember what the 4 components of the change talk are from this morning? It's okay if you don't. It's been a full day. Go ahead, you want to try?
I will.
What was it?
I will.
Okay, oh yes.
I
yep.
can and I am.
Exactly. So you're listening for statements for desire, ability, reason, and need. So exactly right, Courtney. So what sort of change talk do you hear in here? That you see? Yeah.
Well, they said that they're starting to believe their doctor, so that they're starting to believe that this is something that has to change and that they need to make the change for themselves.
So there's a need there. Is there any sort of urgency that you hear in that might be reflected as a need?
I was going to say my blood pressure is just too high. That's like a need for, you got to do something now before you have a health risk.
Okay.
Before my liver cuts out.
Well, go ahead, Courtney. Yeah.
Like she was saying, just before my liver cuts out.
Exactly. So there's an urgency here. The blood pressure's just too high, and, right? He's not just saying it's high, it's too high. And my liver just won't take it anymore. So there's a sense of urgency there. So there's a need there. But like you said, there's probably a little bit of a desire in there too. I'm beginning to think she's right. So carrying that. Good job. Any other thoughts on that one? No? Okay. It would be very hard for me because I love my weed. Again, I try to spread it out. Okay? I'd have to start by cutting back to just smoking after work. So where do you... Go ahead.
Well, when they say I'd have to start by, they're coming up with a plan.
Right.
So they're thinking that there isn't an issue that they need to sort of
Yep.
prepare for. So
Yep.
by saying I would have to start by, and then this is what I would do,
Exactly. So,
they're addressing that.
right, so that could be actually a reason, right, or a need, or even more so a plan, right? They're getting a plan in place, right? Any other change talk that you see in there? Go ahead.
Maybe when they say it would be,
Yeah.
it's making it a possibility versus
Exactly.
saying it is, or I don't know, it's less definitive.
Exactly.
It would be hard.
It's sneaky. So good catch. And so that's what it takes practice to kind of hone in and hear what the change talk looks like. It would be hard, but not saying it's not doable. He's not saying I can't. It would be hard. So there's some room in there. Okay, good job. On finding that in there. See, I tried to add a meaning to it instead of just saying good job. So you got to work that in, right? So it's, you get into the excitement, right? Just good. Okay. So, if you talk to my wife, she'd tell you at least 3. She's been nagging again. She says I'm not reliable and don't come home when I say I will, and that I don't remember some conversations. I guess she's right about those things.
He's saying that I guess she's right.
Okay. Could you expand on that?
Yeah, so he's starting to think that he could possibly do something different.
Yep. So that he's starting to see what other people might be seeing, but he's internalizing it to make it be something for him. Yeah.
And by him being able to list the 3 things, he's giving examples of, like, he's using his wife as ways to get those out, but those are 3 issues that maybe need to be looked at.
Yeah.
So that's, maybe he's thinking that those could be changed.
Here's a thought. So good job. So here's a thought. She's been nagging again. Could you see that as any sort of push to change something?
That could be one of the reasons, the needs to improve, right? Fix.
Right. So is that kind of a reason he just doesn't want to hear it anymore? Is that a reason for him? She's been nagging. You just don't want to hear your wife nagging you anymore. So there's a reflection you could put back. You know, you're tired of it. You know, you don't want to hear this nagging anymore, and you're ready to start looking at some things that you might be able to do differently. Right? Good job. So it's hard, but once you kind of know what you're listening for, it helps a little bit. Okay. So that's diabetic ketoacidosis, in case anybody doesn't know. So I think if I had another episode of DKA, that might make it be a wake-up call. And usually with DKA, you're hospitalized for at least through the ER, and if not, put inpatient. So. It's okay.
Well, that would be the reason. We talked about it, reasons that come from within and reasons that are like external forces. That would be a reason for them to change. I don't know, and I think too that might be a wake-up call. It's sort of diminishing the scare factor, but increasing maybe the the need to talk about this before we get to that point.
Yeah,
It
Yeah.
sort of sounds positive in a negative way.
yeah. How might you be able to reflect that? How?
It sounds like you think maybe something should change in order to avoid another trip to the ER.
Yep. So just reflecting it right back. Right. But that's good because you're starting to hear yourself say that. You're worried if you have another wake-up call, it might be your last one right now. Right? Digging deep. Okay? Because the wake-up call, so he recognizes that he's probably in trouble. So you're worried that that might be your last one, or this might be your last wake-up call to make a change. Okay, good job. It's hard, but it's practice. So again, if you're hearing certain types of change talk, how do you want to respond to that? So if you hear a desire, okay, you're going to want to respond with, why would you want to make this change? So there's a desire there, so why? Why is that? Your ability, okay? So they're thinking about it, they need to do it. How would you do it if you decided to do it? What would that look like for you? So getting them, again, talking about a plan. What are the 3 best reasons to make this change, right? So get them, again, talking about change and a plan. Need, how important is it to you? Okay, why? And then what do you think you'll do? I love that one because it puts it right back to offer them that opportunity. I think the next slide, okay. So this is one of the rulers that you're able to use if you're interested. And so basically what you do is you can use this to kind of get a gauge on importance, confidence, and readiness. So we talked about those 3 components earlier. So what you can do is ask them, how important is it for you to make this change? 0 being not important at all and 10 being extremely important. So say they pick a 7, okay, that's not bad. So what you want to do is, that's pretty important for you to make this change. What puts you at a 7 and not like a 5 or a 6? Because what that's going to get them doing is start talking about why it's important, right? It's not going backwards. So if for some reason they pick maybe like a 3, okay, I'm just really not very confident. So you're just not quite sure if you're going to be able to do this. What would it take to maybe get you up to a 4 or a 5 to get you in that direction? Okay, so this is really useful. And you don't have to actually have a hard copy. This is something you can just kind of work into your conversation and be able to do that. Okay? So that's what I've got for this. Thoughts on that? Oh, you haven't? Oh, so it's a newbie. It's, when I was putting together the talk, I want to talk about everything, but I can't, so I'm just wanting to like dribble some nuggets, see if, to kind of see how people are interested. What are your thoughts on it?
I think it's a really good method. It's a really good method because I've seen like pediatricians talking to like younger kids and telling them stuff that is degrading to them, and that's not going to help them like improve if they have a condition.
Yeah. Intentions are good, but it just doesn't come out quite right. Yeah. Other thoughts? Do you have any thoughts, Whitney?
I think it's a more of a self-reflection, but I feel like with the work, force being such a fast pace, sometimes I don't think we spend as much time reflecting and, I feel like now when we talk to a patient or just even in general to the healthcare team, it seems to be like you kind of like talk to have like an answer ready before you even listen. So this method just has to take time, and so I think it's not something we learn, all the time, and like now it's like, oh, you don't even finish what they're hearing and you're already wanting to give back an answer. So this take you a little bit more time of like you said, take it to learn and then to tie it into your work. It's gonna be challenging, you know, but it will be good to learn. So.
And to be patient with yourselves and give yourself the time. You know, if you want to learn it, just give yourself that time to be able to do it. So, I think are we good? Okay, all right.